All right, and we're back with Tati. Now,
The Raccoon.
Tati the Raccoon. You're right. You're right. My bad. Now, I guess getting back to things, do you ever get really close with any doctors or patients or anything? Has that ever become complicated for testing purposes?
Um, Not so much to like the doctors or nurses, but sometimes people probably misinterpret and think we don't get attached to patients because we're behind a screen and we're not directly dealing with them in person. But if they're in the hospital long enough and we're continuously calling, critical labs on them, we do form an attachment to them. It's more of like a, oh my God, I hope they like make it out of that. And it does affect us when we find out that, the patient has passed. Like we're saying, oh, the person was we were rooting for them and they didn't make it. So we still do form an attachment. I don't know if most people know that.
So they're not just a number.
They're not just a number that comes across the screen. You get familiar with their case and you just hope they get to leave as soon as possible and in good health. At least amongst people I work with, that's a common thing that happens.
Do you guys ever feel guilt? Like, say you had to disregard a sample and say their health deteriorated. Do you guys ever feel guilty or that's like on you?
So, in terms of what, delivering bad news or?
Well, say they passed. Do you guys say like maybe you made a mistake and it led to maybe deferring treatment because of that? Do you guys ever feel like a guilt or a weight of responsibility or anything?
Oh yeah, I mean, no one ever, it's a mistake. No one ever is looking to make one, right? But when it happens, yeah, you do feel a sense of like dread of like, I didn't mean for this to happen, but I hope it did not negatively affect this patient's treatment plan or possibly their life. We take it very seriously. It's not a little mistake. Even a clerical error is not just a small clerical error. It's a major mistake. It can be a major mistake.
I think it sounds like your team is very focused on quality assurance, and everyone's gonna make mistakes and no one's ever gonna be 100%, but you still thrive for 100%.
You thrive for it and you report it in expecting, the general culture is not, there's no retaliation for coming forward for making a mistake. You corrected the problem in time. We'll still investigate to figure out a way to prevent from that error from happening again. So that always happens. We're always just thinking of like, okay, how can we just fine tune this process to eliminate error, like just plain human error.
Right.
All right. Let's talk about, since you guys do care about patients and everything. Are there any tests that doctors run that you feel are unnecessary that they just do maybe as like a generic, like just do this, and you're just like, why? Like one.
Unnecessary in that, so I have come across, we get to see the doctor's name come across the information system. So you'll notice some doctors will have a certain set of tests to order on anybody, no matter what the reason is they come in the ER for. Stub a toe, I'm gonna order the same like 10 tests on this person. Doesn't matter what. And in that case, in my opinion, I feel it's an abuse of um the system because you're running tests that they don't necessarily need to have for like a minor problem.
Just to rank up the insurance claims almost.
But that's my view from behind the scenes. I don't know what's going on there, if there's like a process that the hospital agreed on or if that's just their process of diagnosing patients. So again, it depends. Everyone has a different degree of qualifications.
Or maybe they're just trying to do a catch-all. Maybe they're just, paranoid.
Right.
Maybe they
So
find one more thing that they.
You fat. We better check your cholesterol.
No, but like a lot of times I'll notice they order ACGs and almost a lot of women, just in general. Whatever you come in, that's one of the tests for sure it's gonna get run. I'm just like, why is that? But it's because like there's a lot of disorders that kind of happen when you're pregnant. It explains a lot of things. So it seems sexist at first. You're like, why are you just running ACGs on everybody? No one needs a pregnancy test for a stub toe. But sometimes you need it for imaging and stuff like that.
But I wonder how many women find out that they're pregnant because they run those tests.
There've been quite a few. There's been like I've had that call before where I called on her son like, oh yeah, your patient's their pregnancy test came back positive. She'll be like, oh, they weren't expecting that. They'll have an actual human, there's human reactions happening on the phone. You're like, oh, I don't think she's gonna receive that well. All right, thank you for telling me. Go about your business.
Do you have a favorite test?
My favorite test is I love anything microbiology related, and it can be sterile and it can get really gross specimens like just necrotic tissues and stuff like that you're having to grind and turn to slush so you can culture it. I enjoy all of that grossness. And yet I get tripped up by wet urine bags. I don't know how that works out.
Everyone's got their thing.
But
Right?
I love culturing anything. I've cultured necrotic tissue. I've cultured corneas. It's, I think it's pretty cool. Yeah, it's really weird to see that in a cup, like when the collection comes, you're like, what's that?
Do you have any one that you're like really proud of that you cultured that is like stuck out to you? Like this is my crowning magnus opus.
A legit necrotic toe. It was like the whole toe in the cup. So you have to dissect the necrotic tissue off because that's probably most likely where the bacteria is. Grind it into an appropriate medium. Swab culture it, yeah. Yeah, it's really gross.
What was the purpose of that test, though? Just a toe?
No, I mean, they still have to know, like, which bacteria it is that eventually kind of led to the tissue start dying.
Okay.
So whenever anything gets cut out of you in surgery, whether it's to discard or it became a problem, it still has to go through an investigation process. There's a culture that's happening. There's other tests. There's so many tests happening on it after it leaves your body that you don't know about. That determines like, okay, like which bacteria, was it an infection that led to them having to lose the toe? Like which one is it? How can we treat their whole system if they're septic? Stuff like that.
How many foreskins? How many foreskins?
Oh my God, have I gotten that before? I want to say we've gotten a penile specimen before. I'm pretty sure, yeah. I think it was a testicle or something. Yeah, we get really gross stuff.
As well.
My favorite is always, again, we have like pathology section of the lab where they bring the organs or pieces of you they cut out there to be stored, to be studied, whatever, in formalin. And every once in a while, you just have someone walking like, hey, I've got like this amputated leg. Can you direct it to where I can put it? And I always get surprised every time. I know it's part of the lab, but I forget every time.
I always think of it like when people say you got skeletons in your closet, just this lab has a lot of things, not just skeletons in their closets.
I mean, it's really
a penis, apparently.
It's crazy back there. It's not a normal job.
I was gonna say, so we've asked about what tests they run unnecessarily, but are there any tests that, as a patient, like for general health or anything, that you think that people should ask for? They're like, yo.
A general comprehensive metabolic panel, which measures your electrolyte levels, your liver enzymes, your kidney functions, and a CBC is a common test that most doctors will order on you, and you should honestly make sure that they order on you, because if you go to an annual exam, that's usually the test that they order, because it's a quick snapshot of what is going on in your system at the moment. Very short turnaround time for those two tests. Nice. And also, like, when they come back and say your labs are normal, ask them what are the labs that were run. Make them explain to you the results of the lab. Don't just take the clinician's word for it. I mean, I'm not saying to doubt their knowledge, but inform yourself. Know what your numbers mean. It's just a way to advocate for yourself is what I would recommend.
I appreciate that. Now, you've actually given us quite a bit of positivity. Like, I was actually coming into this expecting some more negative stuff, but honestly, you're
there are ugly stuff. I mean, transplant's been ugly.
Well, actually, let's get into some of these negative issues. Now, I know one thing that you talked about off air, you feel that there's staffing issues.
It's been going on for a while now. There's a shortage of med techs, and they're struggling to produce more. There's lack of schools. They're having to go across states to bring people in from outside the U.S. to come in and fill up positions, because all the labs are short-staffed, and some more than others. So when you're really short-staffed, people are burnt out trying to upkeep like at 8 hours, 10 hours, 12-hour shifts to pump out results, and they have to come back like, I don't know, 4 hours later. It adds up. If the person running your tests and releasing results that potentially affects your clinical diagnosis is tired, imagine how that can affect the patient, you know?
Listen, so it seems more to be a supply issue. Do you think so? It's not a reluctancy of hospitals for hiring; it's a supply issue. That's what you're saying.
It's a supply issue mostly. It depends on whatever the hospital's financial situation is. Sometimes they have hiring freezes, but other than that, there's not enough of us.
Do you think it's because the general public isn't capable of acquiring the certificate, or
No.
maybe even they don't even know about the job?
It does not get talked about at all. It's crazy because you depend so much on that job for diagnosis, and there's just not enough schools, and there's not enough talk about it in college. There's not enough, you know, it's a lack of information, and I wish more people knew about it because it's honestly easy money. It's easy money.
Now,
If you're a science app person, if you love that stuff, then it's just like, I'm getting to do what I like and I'm making good money.
hell yeah, man. That's the dream, right?